Hi friends, now I'm going to tell you about antibiotics used for the treatment of various types of infections. There are of four types, but before that I will tell you that when you take antibiotics, they should not exceed 1000 milligram per day dose for the patient, and they should be taken for 4 to 7 days only. And even after 7 days, if you cannot cure yourself, it can be taken for more days, more number of days. But please, at that moment, go to a doctor. A doctor will examine you, tell him or her how much of the antibiotic you have already taken, and then the doctor will continue the treatment. Don't take it in your hands. Please, now I will start. I will say the names slowly so that you can understand them. I'm afraid to even write the names of the medicines below because if I do a spelling mistake, then again it will create problems. So I will say slowly and I'll start now. Again, I say antibiotics used for various types of infections. They are of four types. And I'll also tell later about other antibacterial sulfonamides. They are medicines only. So now antibiotics, the first type is penicillins. Under this group, following drugs are used for various ailments depending on the type, intensity, and gravity of symptoms. A. Amoxicillin, which is mostly used for the cure of bacterial infection for the throat, when you have itching at the throat or problem at the throat. There is another one called azithromycin that is much stronger than amoxicillin, that I'll tell about later. Then B is ampicillin, C. benzyl penicillin, D. benzathene-penicillin, E. cloxacillin, F. carbamazepine, G. flucloxacillin, H. metacillin, I. phenomethylpenicillin, J. procaine penicillin. Uses of these. Above named penicillin derivatives are used for various infections caused by susceptible organisms, which include endocarditis, reptine conditions, bronchitis, pneumonia, bone and joint infections, meningitis, intra-abdominal infections, genitourinary tract and soft tissue infections, including syphilis and gonorrhea. Second, tetracyclines. A. Tetracycline, B. minocycline, C. dimethylchlorotetracycline, D. oxytetracycline, E. rolitetracycline. Please note, do not use these drugs in children, pregnant women and lactating mothers. Also for weak and run down elderly who have reduced in size. Then third, macrolides. A. erythromycin, B. calcithromycin, C. azithromycin. As I told before, in the cure of bacterial infections, mostly it is taken for throat infections and which is stronger than amoxicillin. 4. A. gentamicin, a broad spectrum of antibiotic to treat severe symptomatic infections. B. kenanicin, C. neomycin, D. streptomycin, streptomycin, D. E. lincosamide. Please note, do not use these drugs in pregnancy, ear disease, patient receiving neuromuscular drugs in venal dysfunction and the elderly people. G. Other antibacterial and sulfanoids. Now the plain antibiotics are over. Now I'm going to the next group, other antibacterial and sulfanoids. They are synthetic drugs which are able to prevent the multiplication of some bacteria, pathogenic bacteria. Now the sulfanoids, other antibacterial and sulfanoids are A. Cotremozazole, cotremozazole, B. Trimetropran, C. Tincdazole, D. Metroincdazole, E. Naltrexone acid. Please note, do not use or use with utmost caution in epileptic patients who get convulsions or fits and those having epileptic tendency in renal or hepatic impairment, pregnancy, during lactation, in adolescents and children. These drugs may include convulsions in patients with or without a history of convulsions, which may also be induced of NSAIDs, NSAIDs, the medicines I told before, and are also taken concurrently. If these NSAIDs are taken, then these should not be taken because it can induce convulsions, they said. Then the first, F is ciprofloxacin, G peflozacin, H sparflozacin, I sulfamazole, J ofloxacin, H antitubercular drugs which are used to treat tuberculosis, A rifampicin, B isomazed, C L-tharbutol, D pyrazinamide, E capreomycin, F streptomycin. Please note, anti-tubercular drugs or medicines used for the cure of TB should be continued as per the dosage suggested by a physician who gave you the medicine. And if the suggested treatment is left in the midway or the person forgot to take even one dose without completing the course for a specific duration, the patient has to begin the entire treatment of the tuberculosis again. Otherwise, after a long time, the person will suffer from tuberculosis again because inside the infection has not fully cured, and if it is not fully cured, then the germs multiply again and show up symptoms. Friends, with this I have ended with the different types of antibiotics and other antibacterial and sulfanomides, and these are mostly the drugs which people get scared to take and they don't know which one to take. I've seen many patients asking antibiotics at the pharmacy over the counter, and it is okay if the pharmacist is very experienced and an old person, but sometimes some trainees, young children, boys and girls are there at the pharmacy. They themselves don't know due to lack of experience what to give, and if they give something wrong, then the person who is taking the medicine suffers. That is why I have given you the names. So please check if and check the name of the medicine when you take from the pharmacy, and also please try to take the medicines from an elderly person in a pharmacy. I hope you like this video of mine, friends. If you like, do like, comment, share and subscribe. Take care and lots of love to you all.